Hello, Rockbridge Area Health Center dental assistants. Today we're going to be learning about making custom trays. Once initial impressions have been made, we pour up the casts. This patient is an upper and lower edentulous patient, and it looks like the sides of the casts need to be trimmed. When trimming casts, make sure you wear eye protection and turn on the water and the system. While trimming the cast, take care that you're not removing any of the anatomy on the cast. The edges should be nice and smooth. All right, now that those are trimmed up, that looks much, much better. This is the point that you need to take it to the provider that is making this case to have them draw lines on the cast, okay? Your provider in this case is making the lines on the cast to show where the custom tray material needs to end. The next step is to use Vaseline to lubricate both casts. Just a thin layer is fine. Next, you want to use a Bunsen burner to heat up the wax. This serves as a placeholder for the impression material when we go to take the impressions with custom trays. Once the wax is soft, you can mold it onto the cast, keeping in mind where the lines have been drawn to make sure that the wax doesn't go past those points. You're going to cut very carefully the wax off to where the lines were drawn. You can see that the wax is pushed close to the cast and is around the lines in most areas. On the lower right side, there's a little piece missing, and you can add additional wax if you're not quite on the lines. Trim the excess areas where the wax is over the line. It'll make it easier for when you make the custom tray. Now for the lower custom tray, it's easiest if you make strips and put it along the alveolar ridge. Again, you're going to keep the wax on the short end side of the lines so that we know where the custom tray material will go. Now that all the wax is on the lower, we'll make sure that it's trimmed right to the lines. Also, before putting the Bunsen burner away, make sure the gas is off and the flame is out before you put it back in the cupboard. Next is adding our custom tray material. It's in a black box because it's light sensitive and can cure the material. So make sure you keep the box closed. First, you're going to, kind of like the wax, you're going to put this over top and adapt it to the cast and the wax. Then you're going to trim the excess material close to where our lines have been drawn. Once the material is on the cast close to the lines, you're going to make a handle. It's really important when you're making a handle that it sits at a 45-degree angle from the front of the cast. And you'll see an example of this shortly. Also make sure that the handle is still small and rectangular. And here is an example of placing it in a way that is 45-degree angle from the cast. Make sure you adapt it to the other material so that it doesn't come out. And there you have it, a cast that's almost complete. We just need to cure it. Now for the lower, we can use some of the excess material from the upper to make the custom tray on the lower. Make sure you trim the excess material on the lower to the line that was created earlier by your provider. Using the excess material, you can make the handle for the lower. Again, make it a rectangular size, not too big and not too small. But this one goes up and down perpendicular on the cast. There's the handle. Make sure it's perpendicular and molded into the bottom. The lower should be straight up and down, as seen here. Now for curing. There's a curing light in the lab. Make sure you put it in and put the settings to 2 minutes and press start. It'll rotate in the box and the light in there will cure it and make the material hard. Also be sure to take it off the cast and light cure it with the underside up. Sometimes the wax can get stuck on there and you just need to remove it. As for the lower, same thing. Set the settings to 2 minutes and press start. and it'll rotate in the box, curing the material. After curing them, they're going to be a little bit sharp along the edges and they're going to go in someone's mouth, so we need to trim them. Make sure you hold the trimmer at a perpendicular position to the edge of the material and smooth out the edges while keeping in mind not making it too short from where the lines were drawn. After they've been trimmed, they look much better. Make sure the trimmed edges are to the lines drawn by your provider earlier. Thank you for watching, and if you guys have questions, please ask your providers or your lead assistant.